was selected, I was asked, and I accepted to be the lead planning team member for the 51st Oncology Nursing Society Congress in San Antonio, Texas. And I have spent the last couple of weeks actually picking my team, which has been an exciting thing to do. I've got to interview the team members and select them. And I had a lot of things I had to kind of keep in mind, making sure I didn't pick everybody. So I'm from Ohio, and there was enough people that applied from Ohio. I think I could have had an Ohio planning team. It's me and 10 other members that are going to help plan the Congress. And so I was able to pick my team kind of with the help of Lanice and Katie from ONS as well. And I am both super excited and nervous because they're like, we have big shoes to fill because Congress has been so wonderful for so many years. So those are some of the things I'm looking forward to, especially being the chair. And it is a lot of work to plan and to meet with your speakers and to get speakers and prepare sessions. But when you're there in Congress and it's all coming together and you're hearing nothing but positive things and people being excited about like, oh, hey, this, I saw this poster presentation on CHG bathing, and this is how this hospital got to, have zero eclampsies. Like, it's really exciting to be able to see things across the country that are really impacting the patient outcomes. I am a program director for the RN Transition to Practice program at the VA Lewis Stokes in Cleveland, Ohio. And so that I'm an oncology nurse as well, but I'm also a nurse educator. So I call myself a nurse teacher. So one of my passions is to teach others and, teach others how to be nurses. I have a mentor who I once asked her, I said, how do you get to do all these fun things? You go to conferences and you're on boards and you do all these fun things. And she's like, oh, well, let me show you. And so she got me connected with our local chapter of the Oncology Nursing Society. And I kind of shadowed for a year. And then I ended up on the board of directors as the education and program chair, and assisted with her in doing the program planning for the local chapter for 4 years or so. One of the things she was like, oh, you can also review abstracts for ONS. So I got connected with ONS and I started reviewing, that's usually just a handful of abstracts, and seeing, those are the ones that people submit to Congress. And so I did that at first, and then I got a little more involved with ONS. And have helped with some review of some courses like the oncology, the chemo bio provider course. And then she's like, why don't you try out for the planning team? And I'm like, what's that? And she's like, that's the people that plan Congress. And I'm like, oh my gosh, that sounds like a big job, but that is something that I would like to do because I am a nurse educator and do a lot of planning. And the first year I tried out, I applied, I guess, and I wasn't selected, and I wasn't heartbroken. I was like, well, if it was meant to be, it's kind of how I feel. If it's meant to be, then I would have been selected. So that year I didn't serve on the planning committee, but then the next year, I'm like, well, I'm just gonna apply again. So I applied the second year to the planning committee and I was selected. And it's kind of, you kind of feel like it's a privilege and an honor when someone's like, oh my gosh, I want you to be on my team. So, so that is my role. My role, I was selected for the clinical practice track for planning the conference. And I also am serving in that role this year. So I am also on the clinical track, planning that this year.